And thank you for joining us once again on PM Express. Tonight we are examining the Ghanaian ingenuity in the midst of this crisis, industry in a time of crisis. Let's start with where we are tonight with our case count. We know that tonight we are at 1,671 cases when it comes to the COVID-19 infections. Deaths, unfortunately, has risen to 16. Recoveries, and that's a positive in the midst of the gloom, has risen also to 188. That's a good story to tell, although the gloom about the number of deaths is also very real. The regional balance is still keeping to what we know before in terms of the hotspots. Greater Accra is leading in terms of the key hotspots, and then Ashanti region as well, followed by the eastern region. Central region keeps climbing, as we're seeing. Now, OT region, it's also playing a very important role in our case count, with 17 and Volta as well. As you can see, the upper east region seems to be galloping now with the cases. It's now at 18, with the northern at 13. Want to now look at the Ghanaian ingenuity. In the midst of the doom and gloom, the numbers that I just presented, Ghanaians are fighting back, mobilizing all the resources, our ingenuity, our skills, to try and put it at the disposal of the state in this fight. Many businesses have re-strategized to stay in business, but in doing so, they are lending a hand to the fight. For example, Casapreco, the company there, you know them, they produce a lot of the alcohol that you consume, but they have tweaked their business now, and they are now producing hand sanitizers. And remember, the most important ingredient in a hand sanitizer is alcohol. And so what Casapreco has decided to do was to convert what their normal production line, and then use a bit of that to produce sanitizers most needed in this time. A great example of what to do in a time of crisis if you're in industry. Another industry in Ghanaian industry that is also lending a hand is a pharmaceutical association, and they've assured that they will produce more of the drugs needed to deal with the pandemic, which is a very good thing. We see the Ghanaian industry is rising to the occasion. There's more, by the way. Local government companies, companies that you've never heard of before, are now producing local face masks, and they're meeting the standards, by the way. Again, the Ghanaian ingenuity. We are finding solutions to our problem in the midst of the crisis. And we've also seen today the biggest of them all, and this is catching some international attention. The Kwame Nkrumah University of Science and Technology, they have developed a rapid test kit for COVID-19. This is a game changer, and we are going to go into this. How much of a difference will this make? They say necessity is a matter of invention. I dare say crisis really also brings out the best in people when they are committed and when they put their minds to it. And that's what we're seeing in Ghana. The GRA even is getting in. It's don't want to be left out. They've turned one of its labs at the airport into a production center for hand sanitizers. That is great news, by the way. Everybody's chipping in. And when you wear your mask, you're also doing same. You're providing business opportunities to these industries who are putting in their best to help us all, but you're protecting yourself as well. This is what great countries do. Patriotism come to the fore. We've seen the industries do this. And so tonight we're going to look at this. How are the industries coping in a time of crisis? As we've seen, many of them are not just coping, they are thriving. Some of them will join us on the show tonight as we explore this industry in times of crisis. Stay with us. Joining us on the show tonight over Zoom is Lucia Addae. He is Executive Secretary of the Pharmaceutical Manufacturers Association of Ghana. Thank you, Lucia, for joining us on the program tonight. Nora Bannerman Abbott is a CEO, Sleek Garment, and of course, as I've indicated already, one of those companies, Ghanaian companies, doing their best for God and country in this time. Michael Ifa is the Deputy Managing Director of Casapeco Company Limited, and they are also doing, in fact, I have one of their sanitizers with me everywhere I go, and so I know what they're doing. You don't know them for producing sanitizers, but that's what crisis does to you. Professor Lucia Addae is the Provost, College of Health Sciences, KNUST, possibly with the biggest, I guess, breakthroughs when it comes to industry. This is a science industry in Ghana, and we'll start with him. Nanao Say Bonsu is the Chief Executive Officer of the Private Enterprises Federation, PEF, and they also, of course, are the association where a lot of these private industries belong. But I want to start with you, Professor Lucia Addae. I guess congratulations are in order for the development, the breakthrough in the rapid diagnostic testing kit for COVID-19. For mere mortals like us, what is a rapid diagnostic testing kit, by the way?
Thank you, Evans. Good evening to your viewers. Basically, a rapid diagnostic kit is a kit which enables one to perform that test within a short time. It's also often called a point-of-care diagnostic, so that within a short time you can do the test. Basically, that's what a rapid diagnostic test is. Okay, so compared with other tests in the same group, which you need to do for a longer time, over a longer time. Okay. In this case, the rapid diagnostic test for COVID-19 we have developed here in Kenya. It takes 15 to 20 minutes to perform, as compared to the current PCR diagnostics, which are done by Noguchi and KCCR, which can take between 2 to 6 hours. The principles that both are based on is different, but the rapid diagnostic kit makes itself available to be done in a short time.
So tell me, so it's in essence, and I've seen it, it looks like the pregnancy test kit. I mean, what? It tells you whether you're positive or negative for COVID-19 within 20 minutes?
Yes. Basically, that is what it is. It's like the home pregnancy kit or the home diabetic test kit. It takes a finger prick blood, okay, and they puts that into a cassette. You add a buffer which runs through, and then you see lines developing on it, which will tell you whether you are positive or negative. But on COVID-19, that is not only that, not either positive or negative. The principles underlying is that when one gets an infection, for example, of COVID-19, the body responds by building antibodies to it. Okay, and you can, when you detect these antibodies, which are specific to the COVID-19 agent, it tells you that you've been exposed to COVID-19. Now, 2 tests of antibodies are developed: immunoglobulin M or IgM, and then immunoglobulin G or IgG. Okay, now the test kit detects both the IgM and the IgG. IgM telling you that the person has recently been infected, and IgG telling you that the person has been infected or exposed to the virus over so many weeks or months. So in other words, you could have been infected with, you could have gotten COVID-19 infection 3, 4, 5, 6 weeks, 7 months ago. The IgG will tell you that yes, you did have COVID-19 infection. Okay, you have recovered, cured, etc. But that's important because anybody who gets the infection, whether you have it now or you've gotten it and recovered from it, the antibody test can tell you that you have it or you've been exposed to it previously. And that's important because one can then estimate the burden of infection in the society. You are not only taking those who currently have the infection, but even those who've had it before and recovered. The IgG part of it will tell you that. So it gives a better indication of the burden of infection.
I mean, I really want to clap for you right now. I mean, this is one of those times you feel so proud to be a Ghanaian. How long have you been working on this? And can I buy this from the pharmacy near me and do my own test at home? When is it going to be available in mass?
Not yet, Evans. There are many stages it needs to go through. In Ghana, the FDA is a regulatory agency for all medical devices. So any new device that comes to the country has to go through some evaluation process by the FDA before you go through the FDA. You work along with the FDA. If there are issues about the tests, the point is that you can always optimize that test and make it better. Okay. So if the FDA comes out to say that, no, we think you need to adjust this bit of it, you keep on working. Once the development has been done, you can always optimize it to the point that you want.
Okay.
And then when FDA okays it becomes available, then it depends on what the Ghana Health Service or the Ministry of Health will say, will then say, what are we going to use it for? What is the policy within which we are going to use these kits? And how can one buy them? Or how can one get them to use? Okay, it may be, you see, the beauty about it is that it can be done by any health professional. You needn't be a trained person who work on it. There are no equipment that go with it. Okay, just like a pregnancy test, you just dip in the blood on the strip and it works. Easily done, easily interpreted. So then it didn't be sent to Noguchi or KCCR anywhere. Districts, hamlets, wherever they are, the CHIPS compound, whoever operates that, can do that test to inform immediate decision taking.
Okay.
I mean, we realize that there's so many samples coming to Noguchi and KCCR. There's a backlog. Okay. And that probably is not getting us ahead of the infection. It takes about 48 hours to receive results at the center where the tests were taken, within which time, if there could be any spread or anything like that, could have gone on. But the rapid diagnostic test enables a health worker or anybody to take decisions in real time in terms of what to do.
Okay, this really is a game changer. What's your? I know you still have a lot of FDA health ministry processes to go through. What's your best estimate? I mean, hopeful estimate when you hope for this to hit the market, for us to use it, and the ministry and everybody else can use it to do what you developed it for. Just briefly.
I can't say. I mean, the FDA has expedited procedures for this emergency. That's important.
Okay.
It's not going to be done as usual. They are going to expedite this being done.
Okay, good.
And then they will come back to the developers.
Okay.
In terms of what else to do. I mean, luckily for us, what we are sending to the FDA, which has even delayed this whole thing, is that there are 3 different rapid test kits we are sending to them.
Okay.
With 3 different antigens, so that whichever comes out the best and whichever the Ministry of Health thinks meets their standard will go straight into it. And the most important bit about this development, I would say, is that it has been done together with a local diagnostic company in Kumasi, Incas Diagnostics. ACCR developed it, okay, with Incas, and has passed on the technology to Incas, which will then manufacture and produce it in mass.
I'm really excited for this.
So that's the academia industry collaboration that has come into development of this kit.
Yeah, Professor Lucia Addae, thank you for joining us with that really fascinating news that we've heard of the whole day, and we're grateful that, of course, the Ghanaian ingenuity is rising to the surface now, and we are the envy of many countries tonight. And there are many of my guests who are, again, doing something and putting smiles on our faces. I want to bring in right now, of course, the Deputy Managing Director of Casa Preco Company Limited, who's also joining us tonight. Michael, I'm grateful that you could join us. And just on the back of the fantastic medical breakthrough that we've just been talking about, I was just introducing and making the point about how I have one of your own sanitizers with me. you are not known for sanitizers, but what moved you to go into sanitizers?
Yeah, good evening, Evans, and good evening to your viewers as well. We responded to the president's call, and immediately we got into production of these sanitizers. And as you rightly stated earlier on, the key thing to add to it is the alcohol, which is what we also use all the time. So immediately we dedicated one line to the production of hand sanitizers and rubbing alcohol. So we got this out in record time, and we also managed to quickly get it out into the various regions. I think initially week 1, we were in about 12 regional capitals. And in the second week, we had gotten into all the 16 regional capitals. And I want to say a big thank you to our distributors who supported with this operation. One of the things that we quickly did well to do was to come up with a price which was right. So you would have the 200 ml at 6 cedis for a bottle, which I guess managed to stem the price abuse that was happening in shops and at the marketplaces. Because of the shortage of it, it was being priced high. So we did well to bring the price down to make it available to everybody in the, I guess now we are all over the country, both urban and rural. Yes, we may not be in all the places, but I think that we are mostly in all the places. Some of the challenges has been that alcohol price keeps going up.
Yeah, I mean, that's a very important point you're making about the challenges. I'm going to come back and explore a bit of that because I know all of you are trying to do your bit, but they are definitely within peculiar, unique challenges. I'll come and explore that. I want to go to Nora. Nora Bonaman Abbott is a CEO of Sleek Garments. Hello, Nora. Thank you for connecting with us on PMS West tonight. I'm guessing that we just saw the Ministry of Health guidelines on wearing a face mask, which is now mandatory. From what I'm told, you are using your skills to now save lives with face masks. Tell us about that story.
Okay, so before we started this major production, as a fashion designer, friends from overseas have been sharing their ideas with me. And I had kind of thought about promoting face masks that would be fashionable and, more attractive to wearing with one's special clothing. But then we were invited to a meeting by the Minister of Trade and Industry. By then, we had heard from the presidency that he believed that looking at the global shortage of PPEs, we in Ghana needed to look at how we were going to be able to manufacture these especially for our health caregivers. So we were invited to a meeting, and at that meeting, that's some of us manufacturers, at that meeting, there was a Ghana Standards Authority representative, the CEO, and also the FDA CEO. And we had discussions about the easiest way and most efficient way to put these face masks on the market. One way was to make sure that the raw material, the fabric, was coming from Ghana, made in Ghana. So we have textile manufacturers with us, that's ATL and GTP. And to cut a long story short, with the help of FDA and GSA, they were able to manufacture fabric that was suitable for manufacturing the face masks. And then the next thing was, what texture would be right to give the right protection, plus meet global standards. And when we talk about global standards, we're talking about a global issue. We're talking about protection from, the spread of this virus, plus catching it. So this is how it started off. A group of us coming together, invited to look at how we could use our facility to manufacture the PPEs for the local market. And this is what we're doing right now. We have dedicated workers, in spite of the danger, because, hey, we've been told to stay at home if you want to be safe. We have dedicated workers who get together every day to manufacture these PPEs from our factories, from Sleek Garments Export Limited and 4 other factories. And I'm so excited to hear about the rapid result tests, because I believe in our factories, we're going to need this all the time. We've carried out various tests. You know, we need to make sure that our workers are safe. And Kasapreku, we're using your sanitizers.
Oh, yeah.
Our workers use it after washing their hands, and probably after every half an hour, you find most of them using the sanitizers to make sure that their hands are well sanitized, beyond using gloves to protect the products. So this is how it started off. I'm a fashion designer, but we must produce uniforms and other kinds of clothing. But now we are focused on producing face masks for Ghana.
Yeah, I mean, never been prouder to be a Ghanaian. And you talked about a meeting, and I know that the Pharmaceutical Manufacturers Association were also called into a meeting with the president, and I'm happy that Lucia is also joining me. Lucia, you made a promise. I remember when you met the president, made a promise that you're going to take up the challenge and you're going to produce what we need locally. I'm curious to know, weeks on, how are you keeping that promise, and what does that look like?
Okay, hello, and thank you so much for this opportunity. Good evening to your cherished viewers. So yes, the president spoke to us when COVID hit our shores. And I must say that even before that, pharmaceutical manufacturers had sat down to analyze the situation. And we realized that when COVID gets to Ghana, we would have to ensure that we have raw materials and packaging materials that will be available for the manufacturing of COVID-related medicines. So when the president called upon us, at that time, traditionally, our members do not make hand sanitizers. But we took on the challenge to ensure that we would make these things available and affordable. So we even came up with a price. And the price was that for the 5-liter gallon, which can be put in dispensers and put at various facilities, it would not be above 150 cedis. And so a lot of the manufacturers, naming a few, Kina Pharma, NS Chemist, Intravenous, Phytorica, Pharmanova, and a few others stepped in and ensured that they would manufacture hand sanitizers. So that's for preventive therapy. So we got the raw materials, and we also ensured that we had production lines with dedicated human resource and all of that to meet that national demand. So strategically, that's what we did at the manufacturing side to ensure that hand sanitizers were available. And apart from hand sanitizers, there's also supportive therapy for COVID-19. There are guidelines that have been developed. And we also ensure that these medications are actually available, of course, at affordable prices to ensure that we protect the citizens of Ghana.
And I must tell you, I mean, before the lockdown, I went into the pharmacy and I bought a lot of those medicines, the vitamin C's, etc., that are produced in Ghana, by the way. I mean, I bought painkillers that are produced by Ghanaians. I bought FPAC, and FPAC also has a vitamin C version, which I also bought a lot of to keep at home just in case. Whilst we celebrate Ghanaians, we also encourage you to buy Ghana. When you go out there and looking for stuff for the COVID-19 specific, buy Ghana, because Ghanaians are doing great. As you're hearing, Kasapreco, Sleek Garment, pharmaceutical manufacturers, even the scientists are coming on board to produce a lot for ourselves. Lucia, stay with me. I'm going to come back to you shortly as we explore this in a bit more. But let me go to Nana Osei-Bones, who is the Chief Executive Officer of the Private Enterprises Foundation. Nana, you must be proud tonight to be a Ghanaian and also to be the Chief Executive of the Private Enterprise Foundation, because enterprise, the Ghanaian enterprise, is really coming to the fore in this time of crisis.
Good evening, sir. Let me first correct. The name is Private Enterprise Federation.
Oh, Private Enterprise Federation.
Foundation.
Pardon me.
Yes, sir. What does this tell you? Ingenuity of Ghanaians, that we've always been preaching local content. Now, this has brought to fore, this crisis has brought to fore a need for localizing our needs. All these things could have been done. Without a crisis, would we have done that? Possibly not. We have to be looking to explore the ingenuity and the business acumen of our industrialists. We don't, as a people, because we believe in going overseas for everything. Now that this has hit, we realize that if we can look within us, we can produce almost everything that we need in a country. As much as the University of Science and Technology, University, bringing this kind of equipment, testing equipment, we also have to look at the efficiency and sensitivity of this equipment, how it's going to address the infections. We're talking to CSIR. You know, we heard Senegal is doing some kind of ventilators and respirators that cost $16,000 per one. They've created one that costs $60,000. Ghana CSIR Industrial Research is exploring to produce the kind of ventilators and respirators. So Ghanaians can do things. We need encouragement of our duty bearers to make sure that the cost of doing business is lowered, the opportunities are created, and so we create the job opportunities for others. Now, these companies that are now switching to do other things, diversity, they have to retool. And we're talking about, the social distancing. How much room do you have to retool at cost to practice the social distancing so your employees coming to work will feel confident that this is what the infection is not going to catch up with them? So we look at these things and we said, okay, the cost of doing business already is high. And I said that the other day at one of your programs, that the funding coming on the crisis, on the back of the financial crisis, the funding mechanism should be provided. Now, if these industrialists are producing, their tax obligations, can they be postponed for maybe 9 months to 1 year? Their other obligations, can they be temporarily held up until they can recover? We now don't know the end game of this pandemic, but we have to plan to see how businesses will resurrect, will recover, and to continue to operate in an environment where the cost of competition is affordable to us. So this is an enlightening episode of how, if we look within, Ghanaians can do virtually almost everything. Yeah, and the next phase is the food systems. Now, all the countries are going to keep their food. Are we planning? Are we looking at where the shortages are? Are we creating the opportunity to satisfy our palate, to satisfy our needs? We should not be reacting to. We should be planning and doing these things in accordance with what we need. And that's, to me, as I said, it's a glorified situation. As the crisis is creating opportunity for inventions, it's also bringing to fore the rude awakening that Ghanaians should look from within, and we can produce.
Yeah, I mean, and I guess that last point you made is, I'm hoping to be one of the abiding, call it the abiding lesson from the COVID-19 crisis, that we can rely on our own companies and industries to produce, and we develop the taste for what they have. Nora, you produce a face mask. I wonder, there are unique challenges within this period for you, and I'm pretty sure you're now buying sanitizers, which is now not part, I guess, of your previous cost line. You're buying sanitizers now for your staff. I'm pretty sure there are enormous challenges to doing what you're doing now, and I'm curious to know what they are and how you're going around them.
Okay, we started production during the lockdown, so there was a need to transport our workers safely to work, and we have a partnership with Yalolo now that provides buses. Of course, we fuel them and pay the drivers. And then we had to make sure we were providing food for the workers, because we wanted them to have food that would, well prepared and safe to eat. Because when I say safe to eat, we didn't want them going by the roadside and just buying anything that was available. So we were providing food, and we still are providing food and transportation. And then we have to look at the workers' safety, the cleanliness of the factory, enhanced sanitizing and everything else that it takes. And when you talk about social distancing, this means that we are not using the full complement of machinery that we have to create more room for the workers to work within that. So the cost of production is definitely high now. But then, to be very honest with you, for now, it's more dedication to putting these PPEs out there as soon as possible. There's more dedication by my company and management to keep our workers and ourselves safe, and more dedication to making sure that these workers come to work on time, but comfortably, and go back home safely. So that's what we've been focusing on. But all of this comes with a very high cost. At the same time, due to the volume that government needed, we've been working with a few other companies. So we've been subcontracting. Through this pandemic and everything else that we're doing, we are actually helping to revamp the Ghana industry. And I must commend the Ministry of Trade and Industry, the minister and his team, because they have been very involved in this. In fact, they called the first meetings, including the Minister of Science and Technology. So there was quite a big team that called meetings. We got together to strategize and plan this. But the costs are very high.
Yeah,
I must admit, the costs are really high.
Mike,
cost also.
Sorry, Nora, I'll come back to you. Let's explore this a bit more. I want to just get the thoughts of Michael on this. Michael, you're a big company. You export quite widely across the African continent and beyond. Some may wonder if your challenges, you had Nora's challenge there. Do you have unique ones with the COVID-19, with the switching you've had to do from purely doing alcohol to doing sanitizers? What are the challenges for you? Sorry, Michael, I think you've muted your microphone is on mute. Okay. Yes. I think we could hear you. Can you try again? Let's see. Okay, we'll try and get Michael to unmute so we could hear him. I want to take a quick break. When I return, I'll hear from Michael. I'll also hear from Lucia, and then explore the enabling environment that the government can create. We've had Nora's example of the Trade Ministry. I'll explore that a bit more and then see how this can be scaled up post-COVID-19. So this become the norm, so we don't just become industrials only in crisis. We'll explore the abiding legacy from this period, and when we return, stay with us. And thanks for staying with us here on PM Express. My guest on the show as we explore industry in a time of crisis is Lucia Addae, Executive Secretary, Pharmaceutical Manufacturers Association of Ghana. Also with us is Nora Banaman-Abbott, he's the CEO of Sleek Garments. Also, Michael Ifai is the Deputy Managing Director of Casa Preco Company Limited. Professor Lucia Addae joined us at the beginning of the show to talk about that breakthrough that KNUST has had with developing the rapid diagnostic test. And now Sebunsu is the Chief Executive Officer of the Private Enterprise Foundation. Michael, I was with you before with the break about we've heard Nora's eloquent articulation of some of the challenges and how they're trying to get around that. I wonder what yours is.
Look, earlier I was telling you that it's, we've had challenges with the cost of alcohol. Alcohol is very expensive, and as we speak now, on the local markets, the cost has, I guess, increased by 100%, and on the international market, it's increased by about 60%. But for us, what we've tried to do is to still keep our price at 6 cedis for a 200 ml bottle of hand sanitizer. It's a bit of a challenge because then definitely it's impacting on your revenue, impacting on your top line and bottom line. And I think the even risky bit is the cash flow management. But we're doing everything possible to stay afloat. We are keeping our costs low. We are avoiding unnecessary expenditure. We are looking at innovative ways of doing business, reaching our consumers. We've got into a lot of discussions with our suppliers from. We're getting our raw materials at the right price. So we're doing everything possible to stay in business to ensure that we continue to supply this sanitizers, hand sanitizers, and rubbing alcohol. Another definitely a difficult situation is the new way of working at the workplace. Social distancing, keeping your hands clean, using sanitizers, washing your hands. I think it's a new way of doing things, and people are struggling a bit to get used to it. But we are enforcing it, and we are communicating very well across to all our employees. And I guess in the last 4 weeks or so, it's working quite well for us. I'll tell you, yes, safety and distribution, safety at workplace and cash flow and then the cost of doing business are the key challenges. In terms of distribution to our consumers, we are doing everything possible to go around all the challenges of getting our things to our customers. So difficult times, but we definitely.
Okay, let me bring in Lucia. Lucia, I wonder, tell me about the enabling environment you probably have from the government to enable the Pharmaceutical Manufacturers Association to still produce what you promised us. You've talked about it already. What does it look like in terms of the environment that you have? Are you getting any incentives?
Okay, thank you. So before COVID-19, it's important to note that the pharmaceutical manufacturing industry had actually been identified as a very strategic industry. So we've had some concession in the past, we've had some support, some incentives. We've had the Ministry of Health with the FDA in collaboration, actually ensuring that some medications are restricted for us to manufacture locally. And we have a roadmap. We also have a strategic document that outlines some of the things that government intends to do for the industry. With that said, of course, we have our challenges. So I share in what has been said earlier about the fact that cost of actually manufacturing now is a bit higher. We need to bring in APIs, which are very expensive. Our working capital is more expensive now more than ever. We need some new machinery to ensure that we can meet the demand as and when required. And that means that we need money, affordable finance. So we are happy that the government is bringing in some amount of loans for us. We've heard about the 3 billion cedis. We are still engaging to ensure that we can get that amount of money at a very good rate, a rate that is concessionary. We are also happy that people are patronizing made in Ghana products. And we hope that this will continue, this will be the trend. In the past or before COVID-19, the data showed that local manufacturers actually make about 33% of the value of medicines that are used in the country. So we'll be happy if we can increase that to 70%. That would mean more investment, more resources. Why not? Because I think for me, one of the things that COVID-19 has taught me is that now more than ever, we should ensure that we can protect or we can provide for ourselves. We should have that medicine security in the country, because if we don't, it would expose us. And when it does, I mean, you and I will be in trouble. So it's about ensuring that there's guaranteed market for us. And of course, the incentive in terms of restricting and ensuring that the environment, if it is creating a certain enclave for us to be able to have some amount of electricity, water, and other things that will be free for a certain period to help reduce our cost of manufacturing, that will be very helpful. The final thing I want to say is that we have people that buy from us, especially government. The government is a big buyer. So we are engaging our stakeholders that continue to buy from us and continue to pay on time. I mean, we don't want you to pay us after a year or two, because we are not in normal times. We can't do business as usual. We need you to pay us on time to ensure that we can manage our resources effectively.
I want to ask you this. Is the public, is the buying public purchasing all that you're producing within the COVID-19 period? Are you seeing patronage?
Yes. So we've seen some patronage, but of course, it's a bit erratic. So you would have certain demand for certain products at a certain period of time. And then other times you would not have the kind of demand that you expect. So there are some low times, and we are managing all that strategically. And there are times that you have demand for certain things. But of course, we want to engage our stakeholders and also encourage them to actually buy more from us, because that would make us more sustainable.
And Nora, what's your story in terms of the market? Are Ghanaians purchasing the face masks you're producing?
You know, interestingly, this pandemic has taught Ghanaians to be wary of dependence on import, where you have no idea, one has no idea of where the source is from. You know, I mean, source and conditions under which products are manufactured. Ghanaians have become more aware of the need to know where their products are coming from and under which conditions they are manufactured. So more Ghanaians prefer the made in Ghana masks.
Okay.
In fact, the demand is so high. And I see, well, we're praying that we get over this sooner than later, because this is going to propel our textile and garment industry to the level at which some of us believe we should have been at long ago. But then Ghanaians now want the made in Ghana masks because they can trust its source.
That's a very encouraging thing you say there. Michael, what about the Kasapreko story? Are Ghanaians picking up your sanitizers and in volumes that allows you to stay in business producing it? I think I've lost your audio again. Let me go to Nana Osaibonsu. Nana, you've heard the stories. There seems to be a bit of the public uptake of these locally produced stuff is good. We've heard the story also about the enabling environment. Everybody has challenges, but it appears to me from what I'm hearing that there's some effort by government to create an environment for Ghanaian business to thrive using COVID-19 as a catalyst or as a basis or foundation. What's your reaction to that?
My reaction, as you said, as is a catalyst. We should have done this long ago. We've always been preaching that the policy framework for government is to make local industries the backbone of what we do and what we need. When cabinet makes a decision to go left or right, the first point of call should have been the business associations and the businesses in Ghana. So to enlighten them that this is what government wants to do, and so you prepare yourself and make sure that you provide the investment opportunity to do the business. It doesn't happen that way. Most of the time, we're reacting to what comes through the public domain. Now, 2 days ago, the president indicated they're going to build about 95 hospitals, about 88 districts and about 7 regionals. What kind of material are we going to use? We have clay in abundance that can be converted to brick. Brick costs less, but the production of brick had to come at the back of affordable energy. If we think through and plan, these things can be achieved in a holistic way where we're using local raw materials. When we talk about local content, it's not that it has to be Ghanaian owned, but Ghanaian businesses in Ghana. Now, after the end of this crisis, who is going to do what? The Cargills and the Newmans and the Coca-Colas have to be encouraged to uplift the small and medium enterprises in the value chain. And this is where we need the enabling environment of government policy, as maybe tax abatement down the road after 5 years, after 7 years, tax incentives to enable these businesses to be attracted to provide help. The Toyotas and the businesses that have enormous capital, it's not only government. This 600 million government is providing. If this has been thought through with in conjunction with businesses, there can be a matching grant, a matching funding from the various private sector sources. So what this crisis had unearthed to us is let's look within, let's plan. I keep talking about planning because we don't normally plan on various aspects. And this is not planning on simultaneous, sequencing action. Simultaneous planning, because we don't know when this crisis is going to end. And we cannot wait for it to end to come to the table and say, okay, this is what we're going to do next. So we have to have a plan in place. It's not a 40-year plan that people have talked about. These are business plans, development plans that will affect jobs creation, affect wealth creation, and affect businesses. Because now, the products that were coming to us from overseas, they're going to dry up because the countries that were sending it to us, they will need it themselves. Are we going to wait till we have a shortage and then react to it? No, we have to be planning to see. And I mentioned the food systems. We import onions, tomatoes, everything from within, from the sub-region and from overseas. Some years back, we were even importing cucumbers from Netherlands. How can Ghana, with vast resources, vast amount of land, to be doing that? We have to have a plan in place, and I think the business association are the key, because every ministry have a business advisory council attached to every minister. We use them properly. So the enablers that we have and that we can create starts from today, not let's wait till tomorrow. That definitely, as one of the participants indicated, the cost of business is high. How do we lower it? The opportunity for business is high. How do we bring the business opportunity? Because I remember the government, the president, when he took over beginning, indicated that 70% of government purchases will go to small and medium enterprises. That has not materialized. Why? Because nobody's watching. So we have to step in and say, okay, the crisis had created a rude awakening of the needs of this country so that the patronage of our products are coming from within, and the manufacturing capacities are coming from within. Yes, we're short of key technical skills and competencies. We have to bring that across the construction industry.
And I see a possibility where COVID-19 can really become the catalyst for reviving some of the industries. Michael, I was with you before the technical challenge. I'm curious to know what the market is telling you in terms of the demand for your product. Are Ghanaians purchasing in numbers that allow you to stay in business? Hello, Michael. Okay, I still can't hear you. I want to come to Nora. Nora, you mentioned something I want to explore a bit more with the garment industry. Do you see this crisis as an opportunity to kickstart and revive an industry that we know has tremendous challenges and maybe die in some instances?
It is an opportunity, but it depends on what we plan and what we want to do from this point. What I'm saying is that for so many years now, some of us have been appealing to government institutions to purchase uniforms from local factories, to source from us. A lot of times, this country and other African countries, and in fact, developed economies look to Asia because they continue to say that it's cheaper to import from Asia. But cheap can be very expensive because importing from other countries means that you're exporting jobs and leaving your people the poor. So we're hoping that this sends a message out there that local textile and garment manufacturers are well and able to supply all the needs of every government institution in this country. And supplying uniforms especially should keep us in business all year through.
Yeah, and I really hope.
We hope that everyone is taking note. We've noticed how excited the banks are also to visit premises to see how production is going. The banking system also needs to change its mode of operation.
And I think from what you're saying, I really hope from what you're saying, it applies to all the industries we've heard tonight, that in fact things change on the back of COVID-19. Thank you all for joining me. Apologies to you, Michael, for the technical challenges that we are unable to hear your final thoughts, but enjoy the rest of your evening. We'll be back tomorrow.